Everything you need to know about actinic keratosis. They're defined as precancerous skin lesions, which have a very high association with chronic sun exposure. They can be typically seen in older white men on the areas of the body which are clearly exposed to the ultraviolet rays. Common locations being the face, the scalp, as well as the neck and the arms. And especially if we talk about the scalp, you look at these areas with hair loss, known as alopecia, those will be even more susceptible due to direct skin contact of the sun rays. Clinical features of actinic keratosis, according to the appearance of the lesions, include erythematous papules or macules with characteristic white scales. On physical examination, they have this classic sandpaper texture. An important feature is that these lesions are typically very small in size, normally being less than 1 centimeter. And the risk of actinic keratosis is that it's associated with progression to the cutaneous squamous cell carcinoma of the skin. Diagnosis depends primarily on the appearance of the lesion, and obviously because there are multiple subtypes of actinic keratosis with variable presentations. In select cases, we might have a need for a biopsy. We will see characteristic hyperkeratosis, thickening of the stratum corneum of the skin, as well as parakeratosis, which refers to retained nuclei within these abnormal cells. Management of this disorder relies on liquid nitrogen cryotherapy, which basically means ablating the regions of the skin with very low temperature nitrogen, especially if we have uncomplicated singular lesions. However, for more widespread actinic keratosis, we tend to use topical chemotherapeutic agents, so things like 5-fluorouracil as well as tirbanibulin, which we tend to apply in more of a cream formulations. And obviously you will have to counsel the patient on preventative measures such as wearing sunscreen and avoiding direct sun exposure. And that's it for this topic. I hope this helps, and follow ConceptRx.